Welcome to the show, folks. So glad you tune in each week. I appreciate it as an understatement. If you don't know me, my name is Mike Asherbranner, professionally known as the Redneck Connector and proud and humble leader of the Hounds of Business community. And you are tuning in to Mike King Biz Radio on ESPN RVA 106.1 FM. Folks, I say it every week, but it's daggum true every week. But today, super excited. The healthcare system is changing fast and not always for the better, right? Costs rise, patients wait, innovation often lags behind the need. But every so often, someone steps forward who isn't afraid to challenge the system, even call out broken parts and build something better. And that's Dr. Jooshi. That's our guest today, folks. Nationally respected physician, double board certified in anesthesiology and interventional pain. Dr. Jooshi has spent 30 years at the cutting edge of medicine, pioneering procedures, creating first in the world protocols, predicting the OxyContin epidemic before it happened, and pushing for ethical innovation long before it became a buzzword. So he's the mind behind the first virtual intervention pain practice, groundbreaking regenerative medicine systems, and AAI.health. We're going to talk about that today. A platform redefining musculoskeletal care, digital health, and patient-centered treatment. All right. So what just sets him apart isn't innovation. It's the integrity, because that's how we roll here, folks. So let's roll this intro, bring up the man himself, and have this discussion. Looking forward to it.
Looks like your business might be in a bit of a pickle. Don't you worry about a thing. You ain't alone in this. You're just a success story waiting to happen. Trust me on that. Every bump in the road is just an opportunity wearing a clever disguise. Welcome to the Hounds of Business community, where we don't just sit around twiddling our thumbs. Nope, we turn those obstacles into mighty fine stepping stones. This here's a place where high-level entrepreneurs and sharp professionals gather to grow their businesses and mindsets, kind of like how a good old gumbo needs the right ingredients to be something special. Ideas thrive here, and collaborations, well, they're as natural as sweet tea on a hot day. Success, it's a journey, and we're fixing to walk that road right beside you. Now, don't forget to follow us on LinkedIn for all the latest tips and insights. We're talking about the kind of wisdom that'll keep you ahead of the game. And while you're at it, head on over to our YouTube channel. We've got ourselves a treasure trove of videos, from expert interviews to webinars, everything you need to stay sharp in this fast-moving world of business. The Hounds of Business community? Well, we ain't just a network, we're a movement. So why not come on and be part of something bigger? Join us today and let's turn your business journey into a real Southern success story. Together, we'll achieve greatness, just like crawfish and singing on a Friday night.
All right, folks. How about it? How about we bring up Dr. Jooshi and see if he knows about crawfish and singing on a Friday night? Let's do it. Welcome to the show, Dr. J. How are you, buddy?
I'm great, Mike. Thanks for having me on. It's really a pleasure and an honor.
Oh man, that's what I was going to say. Wow, because I've seen you. You've been on national news and everything else. But here's what's so cool about you: very humble guy. We were talking backstage, if you don't mind me spilling the beans. We never take it for granted. Every win, win for the people, everything that we do that helps somebody else, man, we still get excited, right? We don't take it for granted, nothing for granted. And that's why you're here, man. As much as what you do is how you do it.
Yeah, listen, you can't take anything for granted. I mean,
No.
everyone knows this, but especially in medicine, we deal with sickness, we deal with life and death, and it hits you hard every day. And even when you're training, you see life and death. Life is not guaranteed. Tomorrow is not guaranteed. Your health is not guaranteed. Your success is not guaranteed.
Right.
Isn't that crazy? Your success is not guaranteed. I mean, how many times have we seen, the CEO of a company, or like some professional athlete, or, an actor, actress, whatever, or even a professional, even, any type of professional, even physicians, by the way. People go into bankruptcy. People fail. We've heard about like professional athletes who are homeless. You cannot take anything for granted, and you always have to appreciate what you have. And if you appreciate what you have, it brings calmness and peace and sanity. You don't lose your mind. And when you don't lose your mind, it allows you to focus on your next goal. So gratitude and gratefulness is actually a way to prevent failure in the future.
See, they hear me say that all the time, but dadgummit, they hearing you say that and people like you. I'm like, there you go, because it's not a me or you thing. It's the principles, right? You either embrace the principles of authentic success or you don't. And so let's dive into this because I'm about to die. Before we talk disruption, Doc, I want to spend a minute or two on who you were before the titles. So, what shaped who you are today more? Getting into med school at 16, that's some Doogie Howser stuff, right? Or predicting the OxyContin epidemic before anyone listens? Or is it something else?
I think titles are just a reflection of maybe who you are, but they don't define who you are.
Mm,
So
agreed.
who we are on a core, our personality, our likes, our dislikes, our goals, our motivations, our family, our friends, all that stuff, that's who we are. And the titles are almost a side effect of that. You can almost reverse engineer who someone is based on their so-called titles, whatever those titles are, because it tells you what their interests are and what kind of wavelength they operate on. For example, if you take a STEM individual, STEM meaning like the science, technology, engineering, mathematics, you take those types of individuals, they typically have a different wavelength than say your arts and literature type of people. There's different wavelengths, and so we'll have different titles, but that doesn't mean one is necessarily better than the other, just different titles. And so I think the core really is just, I haven't changed with the titles or without the titles.
That
It's still the same. I still feel just as excited about life and the world. I still feel excited about learning about different things. I still feel excited about discovering things. And honestly, I feel like I haven't
too.
achieved anything yet. I still feel like I'm like a little kid who's still trying to achieve something. And I don't know what that something is. And I'll probably never achieve that something, but that's what keeps you hungry. It's kind of like that. What's that? Remember that the most famous guy in the world or whatever for Dos Equis? Remember
Oh
that
yeah,
commercial?
the most interesting man in
The
the
most
planet.
interesting
Yeah,
man in the
well,
world, and he's like, stay thirsty, my friends. That's what you have to do. You have to always stay thirsty and stay hungry and never feel like you have, quote, achieved your goals. We were talking before about Jeff Bezos. He had mentioned he always has a philosophy of this is day one. And if you always feel like it's day one, you're always going to feel hungry, you're going to feel motivated, you're never going to feel um, quite frankly and quite hopefully arrogant or conceited. You're always going to feel like, hey, I haven't gotten there yet. And so you're going to remain humble and grateful.
The Rock said something like that. I watched a video. He's like, my back's always against the wall. He's The Rock. He don't need anything. And I think that's what's so much fun. There's people out there who don't need to do anything. And that's a calling card, not to get cheesy, but I'm glad the hounds already know I'm losing it because you're saying it. I'm not saying, but it's the truth, right? Because there's so many people like you, like me, like them, who we could go out there and change the world in a small way. We can make an influence on people's lives, like practically, but we don't have the confidence, or we don't have the support, or there's a lot of self doubt, and that's why we were going to hammer that for that. Thank you for bringing that up because we want you all to be inspired as well to go do your part. If we can do it, it's not easy, but that's what we do, right? We just do it. The guy who climbed Everest for the first time, they said, why did you do it? He said, because it's there. Yeah, go with that guy. I'm going to follow that guy. All right. So real quick, before we jump into it, I have to know if, you've helped 35 patients in 35 states, 8 countries, right? If you had to explain your passion in one sentence, what's the heartbeat behind your work? Why is it such a passion, not just a job?
Uh, yeah, I think I'm because I think I'm a healer, and I've always wanted to be a healer. So for me, going into medicine was more about um, not liking suffering in this world and trying to do my part to end suffering. It sounds cheesy, but actually that's the motivation. And really going back to the title thing, the titles are a reflection, a side effect of that internal desire to make this world a better place. And it continues to be that sort of burning motivation is to make this world a better place. And so uh, when when we see patients from all over the country or all over the world, they came to find me. I didn't seek them out. We don't have a marketing budget that's large enough to cover that geography.
Got a
So
bug zap.
they came to see me because they had heard about me through other patients or through groups or whatever. And it's really pretty cool. Honestly, it's so satisfying. You probably have the same thing when you can reach out and a message of yours is heard 10,000 miles away and changes someone's life 10,000 miles away. So whether you do it, as a coach or as a mentor or as a physician or whatever else, it's that same feeling that, wow, I have made an impact that's truly worldwide and I've changed the world, whatever, however big or small,
Yeah.
but you've changed the world and you have changed somebody's world. So there's two separate things. I've changed the world in the sense you've made an impact globally, but you've changed that person's entire world and their entire existence. And there's something incredibly gratifying and humbling as well with that, knowing that you have that power to do that. But just as much on the flip side, unfortunately, humans have the power to ruin the entire world, and they have the power to ruin any individual's world. So we both have that power, and we can make that decision. You can make that. You can genuinely make the decision. Do I want to make the world and a world a better place, or do I want to make the world and a world a worse place? And I think it takes just as much effort to do either one. So you have that choice. You have that choice, but it has to come from within. I think there are people where that desire to do good just simply does not exist inside themselves. And then there's others where it's like, that's all I know. I don't even know how to go that other route.
I'm not even gonna mess that up with any of my Mike-isms, man. I was gonna. You're absolutely right. It just happened today, right? Phone call, people in Georgia, the country, and Vietnam. I'm like, I can't imagine. I'm just like good old boy from Kentucky. I mean, it's just unbelievable. But don't underestimate it. So speaking of that, let's talk about what you're doing because you do a lot. But the one thing that you're really passionate about and skillful in and doing innovation in is musculoskeletal health, the care. So why is this area in such bad shape in America? What is it that, why is this necessary to do
Yeah.
something innovative?
Well, I'm glad this podcast is 4 hours long. So, because that's how long it's going
No
to take to
kidding.
talk about that.
We're going to have to get you back on. Don't worry about that. We'll get you on the.
Yeah, look, I'll just say in a nutshell, the total impact of musculoskeletal health and injuries in America, the total impact is estimated to be $1.3 trillion.
Wow.
That impact is more than heart disease, cancer, and diabetes combined. Combined. Let
Wow.
that sink in. Whoever's listening to this, you could like pause this when you listen to it later. Let that sink in. The biggest economic threat from a health standpoint to America and probably the world, but definitely America, is musculoskeletal health. And get this, it's the only one that we don't have an objective test for. How crazy is that? The
It's
biggest
crazy.
threat to the health system and the biggest, honestly, everybody has musculoskeletal issues. Everyone's going to get hurt at some point. Everyone's going to hurt their back. Everyone's going to sprain this, sprain that, blah, blah, blah. Everybody, right? I mean, everyone, even as a kid, you're going to experience a musculoskeletal injury way before you're going to experience diabetes or hypertension and heart disease and cancer. So it is prevalent. Everyone knows what it is. And it's the only one we don't have an objective test or an objective examination. How insane is that?
That
We
is.
have tests for cancer. We have tests for blood pressure. We could actually do a blood pressure. We have tests for cholesterol. We have laboratories. We have blood work. We have CT scans that can see calcium in your heart. We have all that stuff. And when we do a physical examination, it's still done the same way in 2025 AD as it was in 2025 BC.
You're kidding.
It's still done the same way. You got some dude or some dudette, as we called them back in the 90s. I think they call them something different now, but you got some person
Right.
who's sitting there saying, I don't know, lift up your hand, lift up your arms, do some jumping jacks for me. Does it hurt here? Does it hurt there? And then they give a number. They'll give a number. They'll say, I think you're at 5 out of 5 or 4 out of 5. What the hell does that mean? It means nothing. And when that same person does that same test a day later on that same patient, he gets a different result. And of course, if you have different physicians, different providers doing it, it's a different result. Well, that's literally what we are solving with AAI Health. We created the first objective, accurate, precise, trackable, and reproducible examination so we can finally have objectivity to this massive problem. Objectivity and data is how you can start having the conversation about how do we lower costs, how do we lower injuries, how do we predict injuries, how do we know our treatments are working. Like, you can't have those conversations unless you have objectivity. And again, to me, it seems so ridiculously simple. It was actually something I brought up even when I was in med school in the 90s. And again, I was laughed out of the room because people are like, oh, what are you talking about? This examination is totally objective. It's like, dude, what are you talking about? There's nothing
Yeah.
objective about someone just saying, lift up your arm. Oh, okay, yeah, I think you're good. There's
It reminds
nothing
me of the it
objective about
reminds me of the field sobriety test. Like you can't really say that's objective. I mean, can't say it's not useful, I guess, but it is what it is. And
Yeah, yeah. It's
that
a, it's a good example in the sense that you're right. I mean, there are some people who simply can't walk a straight line. There's some people who actually
right,
have neurologic issues. What do they do? What is the gold standard? The breathalyzer. What is your blood alcohol? That's the gold standard. That's a number that's
that's objective.
objective. You
Yeah.
can't argue that. And that's exactly what we need in the musculoskeletal world, and that's what we've developed.
Well, real quick, because I want to dive into what it is you develop. And folks, if you're on the air listening right now, thank you for tuning in. Go to AAI.health. That's the website, AAI.health. And real quick, want to give a shout out to Mike King Biz Radio, ESPN. Thank you for the opportunity to push people up. This guy is so beloved in his community, man. He pushes up, Mike King does, so many people, organizations daily. And they put him on the jumbotron during the ball games, man. He's like us. He still like gets excited, right? You never take it for granted. So thank you for the opportunity to push people up in this business sector. And folks, hey, shameless plug. Don't build a business alone. Don't do this alone. All right. If you're a stray out there, you want to build with heart centered, high level people that go out there and lead first with value, want to get to know you. Hey, find us on YouTube. You can find other episodes, Hounds of Business on YouTube. You can find me on LinkedIn, Redneck1, Mike Asherbranner, or you can send an old school carrier pigeon. weather pending, I still take those. All right. So we are back, if you're just tuning in, with Dr. Jooshi, and really talking about getting into from his passion of what he does and why he entered the medical field into how he's innovating today. So you've kind of touched on this, but I want to dive into it. All right. You've built the first virtual interventional pain practice. So for everyday folks like me, what does that actually mean? Tell us about that and AAI Health. Just kind of freestyle and explain to us what it is, why it's important, and who cares.
Yeah. So, my interest and passion in technology start way back in like the early 90s. We were fortunate to be, as far as we know, the first high school that was connected to the internet back in like 1991. So really quite privileged to have that exposure. Uh, and I've always tried to incorporate technology from a meaningful way. How can we use technology to make our lives better and easier and more useful? Not in the sense of having technology take over our lives so we become more disconnected. How do we use technology so we can become better at what we do and deliver things that are better at what we do? So we back in 2010, we became the first hybrid remote and cloud-based pain practice. And those words weren't even invented back then. The whole hybrid remote thing and the whole cloud-based thing, those weren't even
Yeah.
like words back then. In fact, hybrid remote really just became sort of a term during COVID. So we were like 10 years ahead of that. And that allowed us to be a lot more flexible with patient care. It allowed us to do exactly what you said, which is how do you see patients from all over the world and how can you provide care from all over the world? You have to have a system in place to be able to do that. Doing it now, everyone's just like, oh, yeah, no big deal. But doing it before iPads were even invented,
Man,
okay, that was a
you're
deal.
speaking my
That was a
language.
deal. Yeah. So it was, and I remember at that time, everyone was like, "Oh my God, this is so dumb. No one's ever going to do this. You can't do this. This is impossible. No one's ever going to, go for this." And they were wrong, obviously, right? So fast forward, COVID hits, and for us to switch from 25 and to 25%, 30%, whatever, hybrid remote or 50%, for us to switch to 100% was no big deal. It's just a matter of flipping a switch. It's how much time you're doing here versus there. So we went 100% hybrid remote because we already had the systems in place to be able to do that. The infrastructure was already in place, so that wasn't a problem. And then, of course, then the next frontier becomes, well, how do we do examinations when you are remote? How do you do an examination? We had already started working on that before COVID, but when COVID hit, it was like, okay, we need to figure that solution out right away. And so that's when we really started accelerating our utilization and development of seeing patients doing examinations, if you will, virtually. And what we have now is we've come so far along that path that we can do all of that stuff again more accurately, more objectively, more precisely, virtually. Virtually. So our exam is all virtual. There's no wearables. There's no special equipment. You can use your phone. You can use a laptop. We'd be able to do that now more accurately than a human can do in person. And what that does is allows the physician, again, technology is not taking the place of a physician. It's allowing the physician to do a better job. And that's a huge message I want to get across, actually. If I could just take a couple seconds.
Yeah. I
Um,
was going to ask that.
I,
Go ahead.
yeah, like, listen, this is super important. Uh, you cannot replace the intuition, the heart, the thought process, all that stuff. You cannot replace that with AI, and you're not going to be able to do that for a long time. Okay, so we need to make humans better. We're not looking to replace humans, especially high-level physicians. We're not looking to replace them. We want to make them better. They have the knowledge, they just don't have the data. So we
Right.
want to give them the data, give them the tools. It's just like the old days. You know, 100 years ago, you probably had some really good physicians, but if all they had was literally blood, in a cup.
Right.
You know how they did this back then? And back then they looked at it. They just looked and they said, "Oh, it looks red, it looks blue." Do you know they even back in the old days they used to taste the blood? They used to have people who tasted
Oh, you're
blood.
kidding
Say,
me.
"Yeah, man,
Oh,
look." They would be like, "Oh, it tastes metallic or it tastes
oh,
sweet." That's why,
wow.
yeah, a term "I got sugar in my blood" came from that because it tasted like sugar. So crude, but that's all they had. What else are you going to do? That's all you had. So now they have laboratories. That has not eliminated doctors. That has made doctors better at what they do. And that's the same thing we're trying to do here. So we developed this so we can make our job, we can be more precise and make our job better for the patient. So that's what we developed, this whole hybrid remote, this whole 100% remote. And then, of course, leading now to AAI Health. That's that whole pathway happened because of necessity and this
Wow.
desire to do better than what we have now.
Well said, and bravo. So, real quick, for folks listening out there, again, uh, thank you for tuning in. Thank you for being on the live. Super happy you're on the air. AAI, folks, AAI.health. That's the website. And tell us, Dr. J, who is it that can benefit? Is it providers, clinics, hospitals, physicians? Who should go here to check this out?
Yeah, so this is well, the solution is really actually B2B solution, but it's going to
Mhm.
help the patient and B2B in the sense that uh, we would partner up with physicians, we would partner up with health groups like large groups, we partner up with health plans like actual insurance companies. Because here's the thing, insurance companies want a solution. I don't know if they want a solution because they care about the patient or the bottom line, but either way, I don't care why they want the solution. They want a solution.
Right.
And if you can help someone, it saves money. If you can help someone, patient is happier. If you can help someone, doctor is happier. Hey man, win win win. Doctor, patient, payer, they're all happy. Like
Yeah.
that is like the trifecta of amazingness. And so, we're partnering up with again, providers, health plans, employers. Employers, that's a big one because employers also they don't want their people hurt. They want to know, hey man, is my guy going to get hurt? We can actually predict. We have a way of stratifying risk and of predicting injury. We can actually predict if someone's going to get injured, which is great. Nobody wants to like have surgery. No one wants to rip a muscle.
Right.
And then one of the final one actually is medical devices and pharma, because right now their data is based on subjective reporting. That's why a lot of that data is not very good. A lot of innovative products never see the light of day. People don't even know how much innovative stuff has actually not seen the light of day because they didn't pass their studies. And the reason they didn't pass the studies is because all of their data was subjective. So the people in the placebo group were like, "Oh yeah, man, I think this works," and the people in the actual group were like, "Oh yeah, man, I think this works." And guess what? They compared the two, and they're like, "Oh crap, we don't see a difference." And it's because it was all
Right.
subjective. Objectively they would have seen a difference, there's no doubt.
Right.
Because I mean, if you're treated versus not treated, of course you're going to see a difference. So pharma, this could be huge because it might usher in a whole new era of amazing safe treatments that people can't even begin to imagine right now because the current system wouldn't allow it.
I tell you what, if you don't mind, I want to wrap up the last few minutes with leadership because anytime you come out with something new and fresh, and from what I can see from the healthcare, it's not everybody's cheering at first. Let's put it that way, right? So you've spent 30 years in high stakes environment, right? Being in the hot rooms, doing stuff that people went, oh, that's goofy. What's wrong with him? And so leading up to that, I want to know, if you don't mind, again, you've done a lot of first in the world with that mentality. So you're willing to take the hits until, you prove otherwise that it works, or you're on the right track. What gives you that courage to try something before anyone else does?
I don't know any other way. I'm guided by my DNA. Seriously, like I'm guided by my just really rigid principles and beliefs, and ethics, and they always say, do what's right. And even if you're fighting against people who don't want you to do what's right, or maybe they're just people who don't understand. But you gotta do what is really in your heart, and you gotta fight for what's in your heart, because that's how you sleep at night. If once you
Yeah.
deviate from what's in your heart, you're not going to sleep well. You're going to always feel that anxiety, and you're going to feel like you did something wrong, and you're going to feel regret.
Can't look at
The
yourself in the
worst
mirror.
thing,
Yeah.
right? The worst thing in the world is regret. If you have regret, there's no one that can help you with that. So don't regret your decision. If you know that there's something you want to do, then lead by doing it.
Do
Lead by
it.
doing it, and you'll be a much happier person in life.
And it's not going to be pretty. You're going to have problems. People are going to boo
Oh yeah.
you. You're going to look like a dummy and all these things. But here, as we were talking backstage, man, if you don't mind, you get a text message. Hey, you changed my life. Blah, blah, blah. And then you say, I'm glad I went through that. And then you do it again, right? And you become more bulletproof, right? It's like a boxer. If you go into the ring, surprise someone's going to throw a punch. Come on. And so, but the results outweigh the stuff you have to do. That's the uneloquent way of saying it. And I love it, because it doesn't matter if you're in the medical healthcare field, if you're in the business arena. People are hungry for real solutions with heart, man. And that's it. So let me wrap up with this last question. All right. If you can leave, well, I got two questions. I'm like a dog with two food bowls, man. I'm like, what do I ask this guy? I wish we got to have you back on the show. We're going to do this. Great, amazing panel, relaxed on the HOB Live. If you could leave your audience with one truth about the future of care, what's the message they need to walk away with right now, today?
Well, boy,
What's that party word?
it might not be. It might not. It's going to be an honest one. Okay, it's going to be an honest one. So here's a couple things I'll say. Here's a couple messages to take away. Listen, guys, be honest, be truthful to yourselves and others. It'll just make your life a lot less stressful. Follow your heart, who you are, and the only failure is within yourself. If you are your own judge, don't give a crap about what some dude on TikTok says. Okay, if
Amen.
you are following your heart, you have succeeded. So I will say that in general, and that leads me to say what I'm about to say. Listen, the future of healthcare, guys, and then I am so not trying to get clicks here or trying to be dramatic, but it is absolutely, we're in an existential threat right now to the future of healthcare in America. Right now, no joke, there's a proposal right now that would eliminate the entire specialty that I'm in for Medicare patients. They are calling any type of pain, any type of nerve pain, any type of like serious nerve damage. They're calling that experimental and not medically necessary. They're putting a bill right now, and if it passes, not a single Medicare patient's ever going to be eligible for any type of treatment for musculoskeletal nerve problems. It is right now. I'm not making this up.
Whoa.
It is right now. You could Google it. So my take home message is, really be involved. I mean, I don't know how much difference it'll make, but tell your congressman this, that, and the other. But we genuinely need a whole new system. We seriously need a whole new system. The system is so broken right now that it's not even fixable. We need a new system, and maybe, and this is my hope. So here's the glasses half full. Okay, the
There
glasses
you go.
half full is real change only happens when you hit rock bottom.
Hey, when you're me, it does for sure. Yeah, that's why I'm
So
here.
yeah, so I hope that through technologies are like mine and others, that we are the ones who are going to be leading the next generation. We call it health 4.0, healthcare 4.0. That's what it's called. It's this next generation where we're going to be incorporating a lot of these absolutely innovative and transformative technologies to lead the next generation of healthcare.
Hey, healthcare with heart personified, my friend. Dr. Jooshi. Folks, go to AAI.health. Go plug in, reach out if you know somebody who can benefit, wants to have the conversation, or your business, your organization, your hospital, whatever. Go connect with this guy. Thank you for leading with heart. Thank you for this. We're going to have you back unless you run away. So
Thank you.
Pleasure having you, my friend. Seriously. All right, folks, we will be back next week. Hey, this all-star lineup is going to keep rolling. So go out and contact, share, go on. Even sharing social media posts, folks, goes a long way. So thank you for tuning in, folks in the comments, folks on the air. Hey, appreciate you. We'll see you next week, and hope you're enjoying the holiday season, folks. Thank y'all for stopping by. Be sure to follow, share, and like, and send me a message if you had fun today. Y'all come back now.